A treatment chart tells you that you need A drug, B drug, C drug, D drug. And if you don't have this drug, ibu boleh balik ke Indonesia akan mati.
Hi everyone, Phoebe here. Today I'm with Dr. Lum Wan Wei, who is a consultant clinical oncologist here at Beacon Hospital in Petaling Jaya in Malaysia. And he has years of professional experience in cancer care. Not to mention that he holds an MBBS in Manipal University, as well as a fellow of the Royal College of Radiologists in the UK. Right, so today we'll be talking more about, because one of the reasons is Indonesians go to Malaysia a lot is because of
True.
breast cancer. So
Yes.
thank you very much, doctor, for coming here to see us. We'll talk more about your experience, your expertise in breast cancer, and also a bit about breast cancer itself for people to know more about that. Would you want to say hi and
Thank you, Phoebe, and thank you for the Indonesian team for coming over. Selamat siang. Bahasa Indonesia tak berapa bagus, so mesti fasih kurang sikit. Tapi kalau jumpa di Malaysia, kita boleh bicara sikit lah. For now, I think we will switch a little bit in English. So, Ibu Phoebe akan menukarkan perkataan dalam bahasa Indonesia. Kalau perlu, jumpa kita dekat Beacon. Nah, pertama, number one is that I did get my training in Hong Kong. Well, that was many years ago. In the 2006, I came back to Malaysia. Phoebe did ask me to share a little bit of the experience in Hong Kong compared to other places where you do training. I did my training in Hong Kong in Queen Elizabeth Hospital mainly, and also Queen Mary Hospital, and also Tuen Mun. It's actually Hong Kong is a very developed oncology hospital or country, and they're very advanced both in terms of novel treatments, radiotherapy and chemo or target and whatever newer treatments available in the world. In Hong Kong, I did work along with a lot of consultants, and I think the core value will be in terms of treatment. What I learned in Hong Kong is patient basis. Patient is the core of your treatment. Never look too much on guidelines, but must remember the person or the cancer patient sitting in front of you. That is matter most. And most of the patients from Indonesia starting to come to Malaysia is because they find that Malaysia, most doctors sometimes give them the care that they need. I think most important is the care that they want. It's just not open a treatment chart tells you that you need A drug, B drug, C drug, D drug, and if you don't have this drug, ibu boleh balik ke Indonesia akan mati. Oh, that's very sad, isn't it? So I think that will be the important factors.
You mentioned earlier that in Hong Kong you learned that patient in front of you is the most important one, right? Is that why you also take psycho-oncology?
There's no formal training of psycho-oncology in Malaysia or on the world. Sometimes you can see things like lifestyle oncology, but the important aspect of as I get older in my oncology care will be I tend to treat patient as a whole rather than as a segment that they have breast cancer, you treat them for breast issues and other things. I think the important moving forward, most patients in current setting will want to know about if I have treatment, will it hamper my lifestyle? What do I need to eat to get better? Am I going to a right doctor? Is the doctor telling me other things that I want to know? Whether moving forward, can I work? Or can I actually do what type of exercise? I do believe that patients nowadays believe that treatment is 50% medicine, 50% own. I think that's important.
So is that why as well? I think you're really known, when I search for your name and all that, you're really known for giving 2 to 3 months counseling or like post-care to your patients, like going to where doctors might fear to tread and all that. So would you mind like walking through a bit as well, like what those 2 to 3 months look like for you and for the patient?
I got patients who actually come into my clinic who tell me, doctor, I know that I got breast cancer at this moment of time. I'm not prepared to have any active treatment. I want to try A product, B product, C product, and I will just want you to follow me up and see how I progress. Sometimes I just don't omit them because they have went to other consultants and told them, if you don't do the real medicine, they call it, or the medicine that I prescribe, please get out of my clinic. I don't do things like that. So I got patients who actually try some form of herbal traditional medicine for about 2 to 3 months. And then after that, the tumor gets bigger. From this big and becomes this big. So sometimes then they say, okay, Dr. Lam, sekarang saya faham ini perjalanan tak berapa betul. Can I come and see you back for some treatment? So we have patients that I see every 2-3 weeks in that setting. I got patients who actually have some patients who have treatment finished. And they say, Dr. Lam, now suddenly no treatment. I feel very abandoned and I'm very scared that the cancer will come back. Even though they are reassured that the scans are clean. Who is not frightened that after the cancer treatment and the cancer don't come back? Sometimes if breast cancer, they have young small children, sometimes 5 to 6 years old. They tell me, doctor, you don't know, my feeling is that in anything happen to me, nobody will take care of my children. So the fear is very immense. So the ibu will come from Indonesia and say, doctor, kalau saya tak ada rawatan, saya takut kanker balik. Saya memang takut. So then we will tell them, we would do scans for them, do blood tests and reassure them. Sometimes we see them maybe 2 weeks once. Then after that, they got more confidence, they put on weight, their hair grow back, they get back a little bit of energy. They say, oh doctor, I jumpa 3 minggu sekali ya? I say 3 weeks, then 4 weeks. And slowly from there, we build the confidence of patient moving forward. But for cancer patients, it's important. It's important to have regular follow-up, regular scans, and good family support, and a good doctor who can talk to you. Okay, that's important.
Yeah, so I think as you mentioned, like a lot of people, especially from Indonesia, actually come because of breast cancer, right? Is there any pattern, because you've been seeing a lot of patients, especially from Indonesia, is there any pattern that you see when Indonesian people coming in, like what stage, what pattern, the story?
I think the feeling I have for when patients in Indonesia come to see us for breast cancer, it's quite advanced. And it's a bit sad because the patient who went to rumah sakit A and told that ini biasa saja, ini bukan kanker. Then she wait 3-4 months because she stays further from the rumah sakit. Then she come back to the rumah sakit again. And the doctor cakap, minta maaf, ini memang kanker. Then she already delay 4 months of treatment. So when they come in, sometimes relative tell them, jangan buat rawatan, no. Ini rawatan tak selamat. So they also delay. So when we come to patients from Indonesia coming to us, I normally don't push for them to do A, B, C, D, E. Sometimes when the minute they come to certain hospital, the doctors will give them a list. Ibu perlu buat ini 4,000, ini scan 8,000, ini operation 10,000, ibu ini 18,000. Kalau ibu tak ada wang, balik ke Indonesia. I think that's not how we function in Beacon Hospital, or I function. Normally they come in with advanced cancer. Your object is to actually try to find out why the delay, what you can do for the patient to make it more comfortable. And I would say that about 90% of patients coming to Indonesia, coming to Malaysia, the cancer is quite advanced. And bear in mind, sometimes the patients from Indonesia are quite educated. Sometimes they are coming from Rumah Sakit Jakarta, and not the small town alone, where patient who is from Rumah Sakit yang besar come in also miss out because they don't have things like PET scan for cancer, or they think that the tumor was very small and then they went into the operation and find out that there's another tumor sitting in the liver. So I think important thing for Indonesian patients who has any lump in the breast, I'm talking about breast cancer, please don't omit it. Look for a good doctor to make sure that it's not cancer.
I think I can relate a bit to that, is because in Indonesia, like why they come to more on a late stage is because we're kind of confused in terms of like what to test and all that. We know that, okay, if you have like a if your family had breast cancer before, you might need to test and all that. But for like women in her 30s without a family history and are looking all healthy, like what do they need to do to make sure that they don't have?
Because Indonesia is a very beautiful country, let alone a lot of provinces, a lot of islands. So not everybody stays in the big city. So we have to take that into consideration. But Malaysia also had the same setting, but some of the Malaysian patients also stay in smaller kota kampong. So our main concept of patient, if they are listening to this podcast, I hope they are, always remember for breast cancer, we're talking about concentrating today will be if you have a breast lump, if you have a breast lump, don't think of it as cancer, but find a suitable doctor to check because maybe 9 out of 10, it is not cancer, but the one can be cancer. And if you pick it up early, be picked up early by a good doctor, do the necessary tests, then the treatment can be a cure. So the concept wise, for any ladies listening to this talk, is that all lumps in the breast can happen, but must see a proper doctor. As for scan wise, in a local setting, not a lot of ladies likes to do mammogram because they hear that it's very painful. The cold plates hits the breast. Sometimes it's very uncomfortable. Ibu cakap, doktor, saya buat mammogram, sakit, susah tau. So what we normally tell patients, if you're young and you have a breast lump, you can always do an ultrasound, which is relatively simple. And most centers in Indonesia now, I think they will have able to do an ultrasound. So ultrasound is very simple to be done. Then if you're age of 40, if you have the area around, there's mammogram, then mammogram is something that you must consider doing at age of 40. Then maybe some people say you need to do mammogram 2 years once, 1 year once. But for me, as long as you get one baseline mammogram at age of 40, and then if you are able to follow up regularly, that is good, but at least one mammogram. And as you get older, you can still do mammogram maybe 2 years once. And that is important. There are new technology like MRI breast, which for cancer breast that is confirmed for younger patients. But these MRI scans is not widely available, number one. Number two is that cost is high. So sometimes in Beacon Hospital, we do what is necessary. We don't do a lot of list of things which is unnecessary. If you need it, we do it for you. I think that's the important thing.
What about metastatic breast cancer, doctor? I think a lot of people just mention breast cancer, but I know there's a lot of more, like that's more, a lot more towards breast cancer, right? Rather than just breast cancer. So what about metastatic?
Good question, Phoebe. As a patient comes to see us for breast cancer wise, which is the topic today we want to focus, will be breast cancer can be in layman term, stage 1, early. Stage 2, sometimes they will run into lymph nodes. Stage 3, more advanced. And stage 4, which is what Phoebe said, metastatic. So, ibu-ibu dekat Indonesia bila dengar perkataan metastatic, so bermakna kanker sudah merebak from the breast, dari payudara. Mungkin ke tulang, jantung, paru-paru. So, if the cancer has spread, it's called stage 4 cancer. And a lot of Indonesian patients who comes to see us in Beacon Hospital, memang itu kanker sudah merebak ke stage 4. Stage 4 bermakna ibu itu, the patient, has delayed the treatment because of fear or traditional medications, or the cancer has been not diagnosed early. So a PET scan is very important to pick up this stage 4 cancer breast. So some patient in Indonesia will fly over to Malaysia just for a scan. I got a patient who was actually had treatment done in Indonesia. And every year, she will fly over to see me to do a PET scan. Because sometimes she said, doktor, lepas rawatan dekat Indonesia, saya memang takut kanker balik. Lepas itu, doktor cakap tak payah buat apa-apa. Just do ultrasound, just x-ray. Saya pun takut kanker balik. So she'll come over and do a PET CT scan, and we will do for her. And if the scan is clean, then it's good, no? So a lot of stage 4 cancer breast comes in. Treatment is available. Treatment is available. So if you have friends who happen to have stage 4 cancer breast, please tell them that treatment is available, control of cancer is there, and the treatment is not as bad as it is.
Is it actually very common for cancers to come back, or is it like actually a very, very small possibility that the cancer would come back?
In the context of your question will be, Phoebe phrase the questions. Is it common for cancer to come back? Every patient who finished treatment with me will ask, Doctor, is my cancer going to come back? I will tell them if you are 75, then umur 75, then you're not scared because you only have a few years. If the patient will come and see me at the age of 30, the cancer risk of coming back is very high. So the question will be, number one, will be lifestyle. So there's a moving pattern towards the concept called lifestyle oncology, where after treatment, patient knows that if they don't change their lifestyle, the cancer risk will become as good. I'll give you an example just for easy to understand. A cancer lung patient who has completed treatment and still continue smoking, you know that is not good. So then she said, Bapak, bukan betul. Saya pergi jumpa doktor sana, doktor beritahu saya sekarang sudah sembuh. Apa pun tu pun tak payah. So then I told the patient that is quite illogical. So for breast cancer patients who has completed treatment, I always tell them, we sit down, we focus on what is important for you now, your well-being, need to manage your weight, some exercise, eating is very important. Please, if it's possible, don't take a lot of plastic things or fast food. These are important aspects of care that good consultants will try to educate the patients. Important about their lifestyle.
And I like, according to what you just said now, I read a couple of your articles on like Beacon's website about life after cancer and that lifestyle changes cancer, right? If, say, for example, someone actually comes and asks, hey, I just finished my cancer treatment, breast cancer, what do I do tomorrow morning? What do I do different starting tomorrow morning? What would you suggest them to?
A patient who has walked into my clinic and now currently come back and ask me what I should do after my treatment is all done. Kesimpulan, pesakit ada payudara, rawatan sudah habis. Sekarang datang klinik, jumpa saya, tanya apa saya perlu buat. This group of patient, normally I'll tell them that, Ibu, mengapa tak ada bicara dengan oncology yang buat rawatan? Your oncology is supposed to help you through your journey when you have breast cancer. Meaning that it's just not to give you tablets, it's to talk to you about your lifestyle. So if it's my patient who's finished treatment, sometimes if I have time, I normally ask them to keep a diary. Diary is very important nowadays. If we go to a cafe nowadays, you see young people holding a diary, opening up, doing drawings, writing their journaling. So all patients, a bit educated, I'll tell them to keep a diary. Number one will be simple things about their weight. If they're putting on a lot of weight that is not good, if they're maintaining the weight is good. If their weight is too low, then increase a bit. So I'll monitor them every month or 2 months. Number two, some patients of them have menses. So I'll ask them how's the menses. Number three, I'll ask them, are you doing exercise? Very important. Exercise maybe is a very big topic alone. Sometimes we have a talk on exercise alone on breast cancer after treatment, probably take about 2 hours because we need to demonstrate to them apa exercise perlu ibu buat, how long the exercise. Because a lot of Asian context, exercise means going for a walk. Dr. Lam, saya tak kurus-kurus walaupun saya pergi exercise. Saya cakap, ibu, you buat exercise berapa? Saya buat 4 jam jalan-jalan Jakarta punya kompleks. So those are not exercise. Those are exercise is called shopping. So exercise sometimes need to increase your heart rate, need to teach the patient how long to do yoga maybe, some Pilates, sometimes some weight training, some stretches. So it's a very complex discussion, but that is part of the patient's healing process. The third thing we talk about is their diet that they need to write down. Sometimes they don't eat salt, don't eat sugar, no oil, cannot buy olive oil, so no oil, no spices. So biasanya at home they will eat makanan steam atau boil. Doktor saya tak boleh rasa makanan, langsung tak ada taste. So that is a challenge that we need to talk to. We have a diet advice panel. Sometimes just by giving a diet advice to the patient, Phoebe, will take us about 2 or 3 consultations. From white rice to parboiled rice, noodles to yellow noodles. Because in the Asian context, you must remember that we don't eat salad. We don't eat French fries alone. We will have a lot of meat products, different vegetables, even durians and longan, lychee, rambutan, mangoes. So the subset is a lot more than what Asian Western diet is. So diet is something that we ask them to keep a track with the diary. So the exercise, the diet, the weight, the menses, and lastly something called the mood. So sometimes when after patient treatment, they feel a bit depressed, not happy. But you must remember, women are very strong. They give birth, they take care of the husband, they are the pillar of the house. So they are not well, they don't tell anybody. They just go on. So you have free time, Phoebe, you go and ask mama whether it is truth. Okay? So sometimes they are scared, they go back and cry. They cannot sleep. They think about their cancer, worried that the cancer comes back. So there's nobody to talk to. And the doctors who see them said, Ibu semua bagus. No problem. Then the Ibu in the heart has the feeling of fear. And there's nobody to talk to. So sometimes like that actually is something that as more and more cancer patient comes in, we are trying to address this issue that you need to treat both the body, mind, and soul so that the cancer get treated. That's the context.
So is it actually a misconception that people say stress causes cancer, or like if you get cancer you cannot eat red meat or like eat sugar? Is that just a misconception or like what people believe, or is it actually true, doctor?
In the context of stress cause cancer or heart block or skin reactions or rash, if you go to Google and you go to YouTube, there's probably 20,000 people telling you different things. So as an oncology, we can only tell you from literature and information that's given to us. There's no one direct study saying that I have stress, I can link to cancer. But because we cannot measure stress, so how do you say that stress don't cause cancer? So I do believe from my practice of about 20 plus years, stress do cause certain imbalance in your body. Remember when you get stressed, your heart rate goes up, your hands get cold, you cannot sleep, your tummy is not well. If you tell me those are not related to your body, I think it's lies. So I do believe that stress can actually trigger or maybe affect the person's general well-being and may be related to the patient recovery if patient's on treatment for cancer. So that's why I emphasize on my patient during your journey with cancer breast, you have to take in mind a section of your life of managing your stress. So if you will look into the concept of stress, some people would go out to restaurants and they're very happy eating, or some people do yoga and then they'll be very happy. So I told patients that during your process of your treatment, you must find a balance of joy in your mind so that to help you get yourself well in your treatment. As for diet-wise, because you are Asians, we are not Westerners. I got a patient who comes in from Malaysia itself, who has seen an oncologist, who came and see me a second time because she went to an oncologist with a stack of things that she did research on. What is not good, what can be eaten, what cannot be taken. So after the consultation, the oncologist took her files, slammed her on the table and tell her, this is all rubbish. So she was very sad because she took about a couple of days to do some research. So I told her that if you have cancer breast, for my patient knows, sometimes we also need to be understanding to the patient. So I tell them that, look here, what do you believe that we cannot take? So sometimes they're quite intelligent. They'll tell me, Dr. Lam, I won't take A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, the whole alphabet series. Then I said, okay, we don't take A to Z. Then, Ibu, ini list tak makan punya. Ibu nak makan apa? So she looked at the list. She said, doktor, hanya boleh makan air saja. So I said, macam mana boleh hidup? So then, we sit down to start to have a dialogue. Lor. So I said, I think context-wise, the number one thing maybe don't take will be fast food. All the processed meat. Sometimes you look at the literature, sometimes they say it's not real meat. So I think if you can, don't take fast food. They are high protein, high salt, processed meat. Then maybe you can omit microplastic in the drinking system. Don't take a lot of plastic bottles and things like that. Maybe canned food, and then high volume of sugar. But I know that I went to Indonesia for a holiday. The dessert is fantastic.
Correct.
It's so nice, but the sugar level content is very high. So I said maybe less white sugar. Try some honey, brown sugar. And then for meat-wise, they'll ask, Doctor, apa boleh makan? I said, imagine this. A swimming fish is better than a dead fish.
Right.
So I told them, maybe if you're very worried about a lot of things, buy some fish to start first. Then slowly build up to some chicken. If you want some organic chicken, get some organic chicken. Then some meat, things like that. But we always, in the Asian context, try to respect the culture of what people eat. You cannot take the patient's hard work notes and say, by the way, this is rubbish. I always believe that patients are nowadays able to Google and see YouTube. Like now I'm with Phoebe and we are in this YouTube setting. So end of the day, kalau ibu wants some answers, you can always come visit us in this hospital.
Okay, thank you very much, doctor, for straightening all of those, because I hear a lot of people saying all that and everything. But I think for every woman watching right now this podcast, if there's one advice that you could give them to make sure that, if they don't have breast cancer yet, they don't get it, and if they already have, they keep on fighting and try to fix it, what would that advice be?
Thank you for this interview. So kalau ibu ada nak tahu informasi lebih, ikut Phoebe punya website, kan boleh bantukan apa yang perlu. The take home message is don't forget about small lump in the breast. 9 out of 10 it is benign, but the one can be cancerous. So cari rumah sakit yang baru or bagus, and maybe do a ultrasound if you have breast lump. If you are 40 over, 1 mammogram if it's accessible, and don't be afraid of cancer. It is something not to be frightened of. Do visit us in our websites if you need to, and I also wish you well, and don't need to worry so much about cancer.
Okay. Thank you very much, Dr. Lam, for the time to doing this podcast. For anyone who has more questions, you can feel free to drop it down in the comments below. I hope one day we'll visit you again and answer all the questions that people have. I'm pretty sure there's going to be a lot of follow-up questions, but if you like contents like these, then we're going to keep on doing these with a lot of doctors as well. So yeah, please just keep on watching the podcast. And thank you very much, Dr. Lam.
Yes,
for your time.
the younger generation tells me these 3 words that I must use after the talk. If you like it, give us a like, then do a follow and subscribe to the channel. Have a good day.
Like, comment, and subscribe. Have a good day, everyone. Thank you.